I'm going to go ahead and mute myself as well.
Okay. So I've opened up the webinar and attendees are starting to be able to come into the webinar. So we're going to give it a couple minutes and we'll get started.
I'm going to grab some water. I'll be right back.
Okay, we have about 84 people who have arrived so far, so we're going to give it another minute or two to let everyone get into the webinar. Okay, we have about 110 people that have signed in to participate with the webinar so far. It is 12:01. I'm going to give it just one more minute and we'll get started at 12:02.
Melanie?
Yes.
Do you want me to give that brief overview after we do introductions?
Yes.
Okay, and then Anne's going to just give a little overview of the form.
Okay, great. Okay, well, it is 12:02 and we have 116 people who have joined us so far. So first, let me say hello and welcome to the question and answer session today about the Daily Health Questionnaire. My name is Melanie Marquez Parra and I work in Strategic Relations and Communications at Boulder. And I'm here today to support our representatives from Medical Services and from the Office of Information Technology. They'll be answering questions today. Also helping run today's session from Strategic Relations is Brian Bishop. On my screen, he's right there, but I don't know where he is on yours. And we hope that today's session is helpful and informative. And for everyone's awareness, the session is automatically recorded and to be possibly shared in the future or shared with other people who might want to watch it and learn more about the Daily Health Questionnaire. And if during the session you do have a question you'd like to submit to the panelists, there is a Q&A button at the bottom of your screen towards the right. It has like a little talk bubble, two little talk bubbles, and it says Q&A. And if you click on there, you'll be able to submit a question. We will be starting the session with pre-submitted questions. There was an option to submit a question in advance as part of the invitation. So we will be reviewing those pre-submitted questions before we get to the Q&As submitted during the session. And so now we'd like to move on to some introductions of our panelists today. And we have first Gloria Brisson.
Hi, everyone. So I am Gloria Brisson. I'm the Senior Director of Medical Services at the Wardenburg Student Health Center. I have been here on campus for about 15.5 years, and my medical background is that I am a nurse practitioner trained in family practice, although I have primarily focus my practice on women's health and sexual and reproductive health.
Thank you. And also from Medical Services, we have Ann Matson.
Hi, everyone. My name is Ann Matson. I am the medical director at Medical Services, and I have been at Medical Services for about 14 years. I am a physician. My background is in OBGYN, and I have worked primarily in the sexual and reproductive health clinic at Wardenburg.
And from the Office of Information Technology, we have Mark Dykoff.
Mark Dykoff, how you doing? I'm the program manager for our business development and content services team, and I've been with the university about 6 years now. So thanks for having me.
Thanks, Mark. So with the questionnaire being a new process, there have been many questions, and we want to do our best to cover a lot of ground today. So let's get started with our pre-submitted questions.
Oh, Melanie?
Yes, Gloria. Oh, I'm sorry. We skipped the overview.
That's okay.
Thank you.
Yeah,
Gloria.
No. So thank you everyone for attending today, this Zoom meeting. Our hope is really that we can provide maybe some information and clarification, maybe answer questions you may have regarding the Daily Health Questionnaire. So I'm going to give just a very brief overview of the form, but we really would like this to be a session that's fairly informal so that you feel free to ask questions and we can provide some answers. So I think the first question that comes to mind for a lot of people is, why are we doing this? Why is the campus requiring a health questionnaire? In addition to daily health screening being a recommendation from the CDC and the Colorado Department of Public Health and Environment and the American College Health Association, recommendation for all institutions of higher education to do a daily screening. I think one of our primary goals is to create a culture on campus of ongoing awareness and responsibility for everyone. So it's really just another tool in our toolbox to create a safe campus and minimize risk for those of us that actually are on campus. So some of the other tools that we're using are masks and hand washing and asking people to clean their personal spaces when they begin their day or when they end their day at work. Physically distancing, not gathering in groups of greater than 10 people. So those are all measures that really create a culture of awareness. And I think another key initiative is that your organizational leadership is saying, stay home and take care of yourself if you're ill. Don't come to work if you're sick. So it's part of a larger campus initiative to create a safe environment. And the way we want maybe individuals to view the health questionnaire is it should just be part of your daily routine before coming to work, if you have the tools at home to complete the form. Kind of like brushing your teeth or asking yourself, geez, is it cold? Do I need to wear a sweater today or short sleeves? It's just mindfulness and awareness about how you're feeling. So do I feel well to go to work, into work today? It was created by Med Services and OIT staff. The second goal, I think, is it's part of a larger public health effort on campus to educate and inform people who are completing the form about COVID and COVID-like illness, as well as to detect some emerging patterns on campus. So for example, if we have a group of employees working at the C4C building, hundreds of people work there, and maybe 10 people complete the form on a given day and they are not coming to work because they either tested positive or had a contact or they're ill with COVID-like symptoms, they may all have different supervisors. And on the back end, we can see that information and then we can take steps to curb a possible spread or outbreak. So those are some of the reasons. Anne is going to talk a little bit about the form and what happens on the back end.
Thanks, Gloria. So I had the dubious distinction of getting to help design this form, and we did design it for all the reasons that Gloria just elaborated. The form itself is pretty simple. The beginning of the form involves a few questions to identify who you are. And a lot of this is preloaded based on using your identity to access the form. It also asks you some questions about your supervisor, and that is preloaded but can be changed. If there's somebody else that you have determined in conjunction with your supervisor should be receiving the reports of whether or not you're completing this form. The form then goes on to ask where you work, primarily on campus. You are able to answer, to give information on 2 different locations on campus. And again, it's your judgment, but wherever you spend the most time on campus is what we're looking for in those questions. There are then several questions that follow, and they are designed to find out information about whether or not you are experiencing symptoms currently of COVID, and whether or not you may have had close contact with someone else who has COVID or possible COVID. And then lastly, there is a question regarding testing and whether or not you've had any type of testing for COVID-19, including antibody testing, PCR testing, or other tests that may become available. And that's it. That's all that's on those questions currently for the employee form. The data from this form, I know we get a lot of questions about what happens with all these questions and where that data goes. With the first group of employees who filled out the form, I personally was reviewing all the positive responses. My access to this database, which is an on-base, was controlled by my identity as well, and permissions that were supplied by OIT. And there was nobody else who was looking at that data. The reason I was reviewing it was to see a couple of things: how people were doing with the form and where we could help with additional medical assistance on campus. So I don't know if any of you are on this call, but if you ever answered positive during that initial pilot period, you would have received an email from me following up. At this point, because our volumes become so large on those forms, the only forms that I am reviewing, or that anyone is personally reviewing, are the ones submitted by supervisors. So there is the option on the form for a supervisor to submit responses, and those I still personally review every day, primarily to look for opportunities to improve the form if people are having trouble with accessing the form. But there are also some questions that come up there about people reporting that they have COVID. And so making sure those folks have the support that they need at this time. Gloria, anything else you wanted me to elaborate on there?
Okay, so we're going to get started with some of the pre-submitted questions, and then we will also get to the questions being submitted during the webinar. How can I select a different supervisor for the health questionnaire form? How can I get all of our graduate students' forms to go to the chair of their department? Mark?
So the supervisor field is pre-populated from HCM, our human resource information system. So it's populating whatever the most recent supervisor is for that individual or that employee. I do understand that there are individuals that are rostered or that do research in one building and report to one certain supervisor, but also report to another individual within another institution. That way, or for that reason, we made the supervisor field editable. So if it is not pulling your primary or what you think or what should be your immediate supervisor, you can certainly change that information and update that on your end. So that's part one of the question. The second question is, can the form be routed to, what was it, the chair? Sorry.
Yeah, the question was, how can we get all of our graduate students' forms to go to the chair of the department?
Gotcha. So currently the form or the process is, it gets routed, once it's submitted, the form is routed internally to the medical service department, to Anne specifically in her group. There is no, there has been no discussion, or nor have we looked into having the form route to anybody else but the medical service team, and that's because the form does contain personal health information that we only want the medical service team to have access to and to review. We can certainly discuss email notifications. What we are looking to design, or what we will be implementing soon, is a weekly email notification to all supervisors that will have an attachment of the list of employees that have completed the form for that week. Maybe we can certainly add an individual like the chair or some other department figure to that email address, or excuse me, to that email, so that we can have that spreadsheet sent to them as well if they want notification of who's completed it. But in terms of the actual form and seeing the data or the visibility of the form itself, that will not be routed outside of the medical service team. Does that help?
Right. So the only time, so when there's a form completed, the form itself only goes to medical services. What has been going to supervisors is a notification that an employee completed the form, but not what's contained within the form.
Correct. And that was designed specifically for protection of data and personal health information only being seen by the medical service department.
Okay. And if someone has a request, if someone wants to make a request that the notification that the form has been completed go to a certain person, would that be through the help desk to make that request, or how does someone do that?
Yes. help@colorado.edu.
Okay, great. Our next question, Gloria, if our lab is doing our own health form, why do we need to fill out this extra form for the university?
So once again, we are asking all departments to use the form in lieu of individual departments so that we can identify trends on campus and collect the data in a central location. We do actually hope to provide this data in some form on a data dashboard at some point for individuals to access. That would be, I think, the first reason. And then the second would be maybe for consistency of practices. So if individual departments and supervisors are assessing their employees, they may not know all the symptoms of COVID-like illness. They may not be aware of recommended temperatures to trigger possible follow-up, or what recommendations to make if an employee has had close contact with an individual who's has COVID, or if they're waiting on a test result. So it really does take the burden off of the ever-changing guidelines and recommendations that are coming out from CDC and public health, takes those off of the supervisor and individual departments.
So if I'm in a department where there is a departmental form, should I advise my department leader that the university's guidance is that we use the university's form?
Yes, that's correct.
Okay. So our next question, Anne, it's not clear what information the form is providing, since one would think that a person who is sick or has tested positive would not be filling out the form because they would not be going into work. Is this form a way for university officials to cover themselves legally?
So as far as I'm aware, this has no legal ramifications, and certainly that was not the intent in the design of the form. Yeah, there are several ways we might actually find out that somebody's sick. We are not relying solely on this form to do that, but it is a convenient way to message medical services specifically if somebody is out with COVID or on quarantine. Now, you gotta notify your supervisor anyway, so I think probably the preferred workflow with this would be to notify your supervisor that you're out, and then your supervisor could submit the form on your behalf and let us know. Like I said, it's not the only way that we're going to figure out that folks have COVID. As you're probably aware, contact tracing is also part of the way we're getting campus ready for dealing with COVID this fall. And we are establishing a partnership with Boulder County Public Health, where we will be doing contact tracing for folks on campus, and that includes faculty and staff. And so we will have access to that information through Boulder County Public Health as well. This is just one more way we might get it sooner, or might be able to incorporate that in statistics, de-identified statistics that are looking at possible COVID across campus.
Our next question that was a pre-submitted one is also one of our Q&As that's been submitted during this session. And that is about information being saved in the form from day to day. So Mark, this is a question for you. It says, is it possible to have the form save all of the employee information from day to day so that maybe the phone number or the supervisor contact info could be there?
Currently, the form is only pulling back metadata from HCM for the pre-populated for name, for email, and supervisor information. The phone number we left purposely as a free form field because sometimes the phone number within HCM or the HR database is not the most accurate or updated, or people change their phone numbers frequently, or maybe they have their work phone number, office phone number within the system, which is pulling back, but we want the most available phone number so that they can be contacted. So that phone number field is somewhat tricky. So we left that blank, and that cannot be, the reasoning behind that was, like I said, the other portions of the form would be, what was that, the supervisor phone number? Sorry on the question.
Oh yeah, the question was about supervisor contact info, phone number, just about having that pre-populated content in there.
So the supervisor information is being pre-populated from
Okay.
And if that information is inaccurate, like I was saying previously, it can be overwritten, and the correct information can be submitted within that field.
So related to this is one of the questions that was submitted just now, is that if the pre-populated information is wrong, how do we get that corrected so that it's populating with the right things?
That's a good question. We can follow up on that. I don't know offhand what the exact process would be to get that information over to campus HR so that they can update it within the system. That's something we can certainly follow up on. I'm just not familiar how your personal information, maybe you can update it through my CU info somehow. I'm just not familiar about how you can update your personal information within the system, but that's something we can follow up on for sure.
Okay. Our next question, Gloria, will there be a health assessment required for members of the public or vendors that come onto campus?
So there is, currently there is no requirement for campus visitors to complete any sort of a health questionnaire. The requirement for this form is faculty, staff, student employees, and long-term persons of interest, i.e. some of our contractors on campus have identities and access to Skillsoft, so they would be asked to complete the form. There is a student version of the health questionnaire that is being developed now. I think it's slated to be piloted maybe next week. So students will also be required to complete a daily health questionnaire when they come on campus come fall.
Mark, is there a plan to make an app that remembers answers to make the form easier to fill out every day?
We are looking into that. The reason why the form is what it is today, we're utilizing technology that we've already purchased. We have our document management system and workflow system on base, and that's what we're using currently to publish the form and store the data within the backend, and also have the integrations into the different source systems such as HCM. We're talking about developing an app that's a lot of effort and a lot of time that goes into that. And with this process, we had somewhat of a short turnaround that we had to get this up and running. We had our research faculty and staff coming back to campus, and there was a very quick deadline to have this put together. So we were able to use our existing technology to put that together. An app is certainly somewhere we want to be in the future. We haven't slated the timeline for that yet as to when we would be able to develop and deploy and launch that. There's a lot that goes into developing an app, especially when publishing it to, say the Apple App Store and the Google Store or whatnot. So that's something we're looking into, but right now we're focusing on what we have currently and improving that as much as we can to make that user experience the best that we can make it for now.
And related to that was another question that was submitted about daily reminders. Is there a way to get a daily email reminder to fill out the Daily Health Questionnaire?
So I think there is a possibility to send a daily email, but I think the best way to do it is for that individual to set up a reminder within their Outlook. That's certainly what I do with pretty much half my life. So I think that would be the best, because I don't think we'd want to blast the entire organization or employees and supervisors with an email daily when an individual could certainly easily set that up within their Outlook. And that would be my best recommendation. That's what I do.
And Mark, one more technology question. We have about half the time I try to access the form, the page doesn't load or shows an error. I have to keep reloading until it works. Any advice there?
I haven't seen, when I read that pre-submitted question, that was the first time that I heard that there was issues loading the form itself. If that individual would like to submit a ticket to Help at Colorado, I can certainly work with that and see, maybe do a screen share so I can see what the end user is experiencing. But I would say just keep refreshing. I would want to understand if there was, connectivity issues with the internet, if they're on, their cellular device that's on a data plan that's off network somewhere. So, I mean, there's a lot of variables that could play into that, but that's something I would want to dive into personally to see what, that issue might be.
Okay. And the next question is about the symptoms that are listed on the form. The registrant wrote, the symptoms listed on the form are not specific to COVID-19. Does the administration take this form seriously?
Yeah, I think they do. But you're absolutely right. The symptoms listed are not specific to COVID-19. They are, however, the symptoms that are currently recognized by the CDC and by the state of Colorado, the CDPHE, as being symptoms that should trigger a thought about whether or not what you're experiencing is COVID-19. I know the other question that's come up is sometimes people are experiencing these symptoms on a more chronic basis, or they know why they're experiencing them. For instance, headaches. You might know that you have migraine headaches and you wake up with your usual migraine. So we have changed the language a little bit on that question. The current language is, do you currently have any of the following COVID-19 symptoms that are not typical for you? What we're really looking for is a change. Yeah.
Okay. So our next question, Mark says, our research building has researchers from a wide variety of departments. The health questionnaire populates with a supervisor. However, in our case, that is not helpful for researchers who are not rostered at our institute. Should we advise researchers to edit the supervisor field so that the questionnaire routes to the building proctor? Or for students who have multiple supervisors, should they enter the supervisor for whom they are doing the research for or with? And what should the supervisor be doing with them?
Well, like I mentioned previously, the supervisor field can be editable, so they can change that supervisor information to whomever they think is, needs to have that information. But I might refer to Anne and ask her what your opinion on that would be. I'm not exactly sure what the guidance should be in terms of, who that information gets reported to when they do have multiple reports.
Yeah, I think the loop there with the supervisors is really intended to have someone that the employee is reporting to, or who has oversight of that employee, who can follow up with the employee if they're not completing the daily health questionnaires. So the supervisor, as we've mentioned earlier, just gets a report about whether or not the questionnaire was completed, none of the information in the questionnaire. And so whoever you elect to put in that field is the person who could follow up and say, hey, I noticed you're not filling these out, or you're doing it every day. Awesome, great. That's really the intent of that information.
And for Mark, we have this question. I am a supervisor and yet I have not received emails of completed health questionnaires. Who do I speak with about correcting?
If you could again submit a ticket or request to help@colorado.edu, that'd be great. And we can look into what the disconnect is. That'd be great if we could look into that.
Okay. Gloria, this question says, what follow-up questions can supervisors ask employees who have already filled out the form? What is protected by HIPAA?
So once again, supervisors are not going to receive answers to specific questions. They just receive notification that their direct report has completed the form. I would, encourage an employee to follow their department protocols and practices for calling in sick if they are calling in sick, and encourage you to discuss possible COVID-like symptoms with your supervisor, but it should really be no different than any other time that you're calling in. The university at this point is not mandating that an individual employee report that they have COVID. That could change, and I think there's some discussion about that. But if an employee discloses to their supervisor that they possibly have COVID, or they're being isolated and quarantined because of contact or illness, then the supervisor can really help that employee connect with employee relations and fill out paperwork and get the appropriate leave, because there is additional leave available through the university for COVID illness.
And will this also be sent to all student employees on campus, including permanent and temporary student employees?
So there is a version of this form available currently for student employees, and that link is found right next to the employee link. They are separate links because they key off of different numbers. For employees, it keys off of our employee number, and for student employees, it keys off of their student ID. But it's there already and is on the same page on the COVID information for the campus.
And what do I do if a family member has traveled out of state? Is there anything different I need to do?
So for you personally, as long as you're feeling well, the answer is probably no. You don't need to do anything different than the usual masking, 6 feet distance, careful hygiene, hand washing. That family member may need to do something different depending on where they've been and what the current recommendations are for that type of travel.
Kind of related to that as well is the next question. If there are currently out-of-state travel restrictions or quarantine requirements, why is there not a question asking if you have traveled out of state during the previous 14 days? Also, is it relevant to know, if family members have traveled out of state, which we just talked about. Yeah. So this is more about, is it relevant to have this question on the form?
Yeah, it's a great question. This form is not designed to be a complete health assessment. And so travel was something that we did not include on the form. But you're absolutely right. That is a consideration and potential risk.
Another question, Anne. Let's say yesterday I was exposed to a confirmed positive case. Today I get tested and it comes back negative. Now I'm on day 3 of my exposure and show no symptoms. Does that still mean that I cannot come back on campus until the 14-day window has expired?
Yeah, so this gets us off the form a little bit, but I'm glad to answer this. So if you were exposed to a confirmed case yesterday, and I'm going to assume by exposed that you mean less than 6 feet for more than 15 minutes. And that really doesn't matter if you're masked or not, or indoors or outdoors. That's the current definition of close contact. So we'll assume for a moment it was a close contact. Then you're absolutely right. The recommendation is that you should quarantine for 14 days. If you get tested today and that result is negative, it really doesn't tell us what's going to happen the rest of this period of time. So you've still got 12 to 13 days where you may show the illness. And the fact that your test is negative today doesn't mean that it might not be positive in a few days. And it also doesn't necessarily correlate with development of symptoms. So unfortunately, even with the negative test and no symptoms, the recommendation is a full 14 days of quarantine. That said, we are definitely looking at potential ways to shorten that quarantine period. It's something we keep an eye out for in the research that's ongoing. We talk with our epidemiologists here on campus because we realize that's a difficult period of time, especially when we get to talking about that with students.
Thank you. Gloria, do people who feel unwell need to fill out the questionnaire every day they feel unwell, even if they are not going to be on campus, or just the first day?
So if you were scheduled to be on campus and you're calling out sick, then you should complete the form, or your supervisor should. If you are working from home and you feel ill, but you're going to continue to work from home, you would not need to complete the form. It's really for individuals that are coming on campus or are scheduled to come on campus.
And Gloria, if someone wants to get a COVID-19 test but does not own a car, how can they get tested? I know this is getting a little bit off the form, but it was one of our submitted questions. Currently, there's no service to transport someone to a testing site or for a testing van to come to someone's home. This is especially important for people who are not students and cannot go to Wardenburg.
I totally agree. It's a huge challenge, and there absolutely is no perfect answer. I think if an individual isn't ill and they can seek medical care in the ways that they normally would, that would be a recommendation. If the individual is actually ill, I would contact your PCP and ask them, see what testing options or recommendations they would have for you. Certainly no perfect answer for that.
And Anne, if someone, this is getting back to the form, if someone reports COVID-19 symptoms in the questionnaire, will the supervisor be notified? Will a healthcare provider contact that person?
So the only notification the supervisor would receive based on that form would be a notification that the form has been completed. So it would look no different than if the questionnaire had been answered and no symptoms were identified. Currently, you will not be contacted by a healthcare provider here from Medical Services. As I said, I'm no longer reviewing all of those positive responses. We have to date completed over 23,000 of these questionnaires on campus. So that's a huge number that we don't have the staff to review individually, even with the smaller fraction that are positive. That said, the form does incorporate information about next steps. So if you report that you're having symptoms, it will give you a pop-up about what is suggested for next steps. If you report that you've had a close contact, it will also give you a pop-up about what to do next. And you can always reach out to us. We're always glad to supply that information. You know who I am now. You can email me.
How should I answer the questionnaire if I suffer from a chronic condition that has symptoms coinciding with those listed on the form? For example, I have chronic congestion and runny nose due to my allergies. Currently, if I indicate that I have this symptom, the questionnaire advises me not to come to campus and to seek testing options. Should I be barred from campus due to my allergies?
Definitely not. So this alludes to what I spoke about earlier, and we really appreciate this feedback because this is one of the ways we've been able to update the form and I think make it better. So we did get several comments about this over the last few weeks about the symptoms. And so I read you that language earlier about, is this something that is not typical for you? And I think always I would encourage people to use their best judgment when they're answering those symptom questions. There is no direct ramification. What we're really trying to do is just build community understanding and a community culture about not coming to campus if it might be COVID. But if this is something you know exactly what it is, you've had it before, use your best judgment about what the safe thing is to do. I also wanted to touch on one other thing, which is this is a living document, and we are updating it, not quite every day, but definitely every week. And so this type of input is really valuable.
Gloria, as a supervisor, what steps should I follow if an employee doesn't complete the form on a daily basis?
So just some guidance, practical guidance. I think the first thing I would do as a supervisor would be to talk to my employee and see if we can identify any barriers that might be preventing the individual from completing the form, i.e. technology could be one. And then I would probably, if they are refusing to complete the form, then I think at that point it becomes a performance issue, and you need to have a discussion with them. But my first thought would be to talk to them and maybe find out why it's not working.
And I think we touched on this topic a little earlier. How will a person of interest have access to the Daily Health Questionnaire? Medical services will have student externs, student interns, or volunteers in their department completing required clinical hours.
So currently the way the form is set up, it will be available to persons who have an identity for the CU Boulder campus. And the expectation for those persons is that they will complete it. These other groups, especially the student externs and interns, is not something we've looked at yet. So I think that's worth further consideration. I think there are some other ways to encourage people to do daily symptom checking, but the more we can get the entire community participating with this process, I think the better it will be.
Okay. One more question from the pre-submitted, and then we're going to move to the Q&As that we've have submitted during the session. It says, as we're planning on having some students resume research work in our lab, we're planning on measuring their temperature each day before we allow them into work that day. We would like some advice on this procedure. Is it allowable? If so, how do we make sure to handle each student's temperature data so that we don't violate any confidentiality?
So I would say that I don't know about allowable, but I would say it's probably not recommended. And part of that is the challenge that this question raises about confidentiality and inability to not violate that, as well as you have to then start thinking about your instrument and your thermometer and consistent readings. How are you going to disinfect it? So I think those are some of the challenges, which is one of the reasons that we are using this standardized form.
Okay. I'm going to start getting to some of our Q&As that have been submitted, and we will try to get to as many of them as possible. When would a supervisor submit a form instead of an employee?
Go ahead.
I was just going to say, I can give you some examples. People who've had technological issues with the form. For a while, we did not have the student employee form, so we had supervisors filling it out for student employees. And then we've had reports of people who've had COVID. And then we've also had some questions. It's been a way to submit some questions, and that works pretty well.
And this question, I think we've addressed it. Does the form get routed to the supervisor too? The answer is no. The actual form does not get routed to the supervisor. Supervisors receive a notification that an employee has completed the form, but they do not receive the actual form. Our next question, if an employee wakes up not feeling 100%, for example, a slight sore throat, maybe it's allergies, but could be something else, should they submit the form if they decide to stay home?
If they would have normally come into work, yes. If it was a day they were scheduled to be on campus working, yes, they should complete it.
You know, the other piece of that is that the form, like I said, is going to prompt them with what to do next. And then in that scenario, even with mild symptoms, given the amount of community transmission that we have for COVID-19, it would be important to get tested right away.
Another question about the notifications. Could a second person be listed under the supervisor information for notification purposes? And I think that'd be a question for you, Mark.
Yes, that is possible. We can work with that. It would be, basically what would happen is there'd be an additional, we'd have to add an additional field to the form for that information. So it would be optional. So that's something we can look into if that is, you know, something that we want to holistically solve for versus just a one-off. So it'd be a decision that we'd have to make with the team.
Okay. Suppose I can't take my temperature accurately at home. What do I do?
Well, that is a challenge. I would, if you think you have a temperature, you know, we call it a tactile temperature, and you think you are ill, I would stay home with symptoms. Some departments are getting some disposable thermometers for individuals who do not have access to thermometers at home. Yeah. I don't know if you have any other ideas, Anne.
I think those are pretty good practical alternatives. Maybe trying your friends or family and see if there's somebody who can help support you in that situation as well. It's hard to get them in the store right now.
The next question says, is the form actually an app? If not, how or where will employees access it? When does the process go into effect? I'm not sure I totally understand the question, but I think, Mark, you addressed this earlier, that the form, we don't currently have it as an app for a phone. Is that right, Mark?
Correct, but you can certainly bookmark that as a icon on your phone itself, and there's instructions on how to do that, so you don't have to actually go out and search for the link to the form. You can have it as a bookmark on your phone itself. And then, what was the second part? Sorry.
I think the question was how could people access this app, but we don't have an app for this function right now.
Yes, that's correct.
And the form itself is available through a link on the coronavirus webpage for the university. There are some other ways to access it. There is a QR code available if that's helpful. And I think if you contacted Mark through the help desk, we could make sure that gets to the appropriate folks.
I think, Melanie, I heard the second part of that question was, when does it go into effect?
Yeah.
Mm-hmm.
And it goes into effect when you are required to work on campus. So if you're working on campus now, you should be completing the form. But if you're not,
So people who are continuing to work remotely for the foreseeable future, I don't need to be completing the form right now.
that's correct.
Okay.
And
Is it a HIPAA violation? Oh, go ahead, Brian.
regarding adding the app to your phone as the icon, in the Q&A, Terry did add in how you can do that. And Mark also discussed it earlier. So if you have any additional questions, just let us know. But if you go down, it has the instructions on how to do that.
Is it a HIPAA violation to require staff to inform their supervisors if they have or suspect they have COVID?
I think that's the decision that is being made right now by HR, and I don't think there's been a final decision made that you are required, that it's mandatory to notify your supervisor that you have COVID. If that should become a policy, I'm sure they will have vetted that through legal.
I would just add that there are some exceptions to HIPAA in the setting of a public health emergency.
Our next question. We have several frontline employees without means to fill the form out before coming to work. Additionally, we meet each morning, socially distanced, for a safety briefing and work assignments for the day. Our plan is to fill this out on paper. Does that meet the intent of this program?
So I think what we would be missing there if it were completed by paper is the capacity to aggregate that data and look at it from that perspective. But certainly it is in terms of the cultural message of evaluating symptoms before work. I wonder if there would be a way to provide technology for individuals to complete it, individuals who don't have technology at home.
To maybe have a few computers available, or
That may be an option. Yeah.
And another barrier that we've heard about completing it at home has been language. And so there are translations very close to being rolled out that will be available to folks.
okay. What is the best way to request a campus building be added to the campus location drop-down menu?
Again, you can just email help@colorado.edu, and that'll get routed to my content service team, and we can update that on the list. Just a note, so the data for the drop-down for campus location is being pulled from the CU Maps application. So it has been consistent with that. So just so you're aware, that's where the information is coming from. But yes, go ahead and email help@Colorado.
Our next question, as a supervisor, this has happened a couple of times over the past few weeks. The employee has been asked to stay home and monitor. We do not want to overwhelm you all with very low likelihood symptoms. If symptoms progress, they are instructed to submit a form while off campus as soon as their temperature goes above the stated limit. So I don't quite see a question there, but I think maybe they're checking to see if that's the appropriate way to go.
I would say complete the form if the employee was scheduled to be at work.
Yeah, and from a medical point of view, don't rely on the severity of the symptoms to indicate whether or not it's COVID. If there's any symptoms that are concerning and it's possible, get tested.
Our next question, how can supervisors confirm and or edit their contact information? And I think, Mark, you talked earlier about that perhaps when we go into My CU Info, there's a way to edit our contact information.
Yeah, honestly, I'm not sure how to get your information updated within My CU Info, or if that's something that you have to reach out to campus HR.
Our next question, just want to verify who should be submitting the form and when. I thought it was only for employees coming to campus, but then I saw this statement in the CU Boulder health policy. Employees or students who are sick must stay home and complete the health questionnaire and illness reporting form remotely.
That is confusing. It is designed to be completed by individuals who are reporting to work on campus. So maybe that came from, where was the site that was referenced?
CU Boulder health policy.
Okay.
But yeah, to be clear, this form is intended for people who are approved and are scheduled to be working physically on the campus. Do students need to submit the student one and the student staff form? So if I'm a student employee, how many forms am I filling out?
Question. Right now, the student form is not available. So the easy answer is just the student employee one. If you're working as a student employee. They are different, but they are fairly redundant. I think one or the other is sufficient. There are some additional workflows that might piggyback on the student form because it involves some graphics and some confirmation that the form's been completed. So there's some different workflows there. But for now, I would suggest student employee.
I understand we're to complete the form before coming to campus. Is there an exception employees should complete the form when they're informing a supervisor to request sick leave?
I don't know that I understand that question.
I think what they're asking is that if I'm informing my supervisor I'm going to take sick leave, do I need to complete the form in that scenario?
If you were scheduled to be on campus, yes.
Okay.
Alternatively, your supervisor could do it for you, but
Yeah.
one or the other should. Yeah.
Okay. We have someone asking if the recording is going to be available for review for those who were not able to attend the meeting, and I will look into seeing how we can make it available. Non-CU visitors who are taking part in human research studies cannot access the form. Do they qualify similarly to campus visitors, or should we be asking them the questions on the form and reporting them some other way?
So they would be considered campus visitors. They do not need to complete the form. Having said that, I know in medical services, we screen everyone who comes into the building. So it could be a part of the research protocol that they are screened. We had CTRC in our building in the spring when the pandemic first arrived, and they were screening. So it would be, to keep their research subjects and their employees safe, it's reasonable to just do a manual screen.
Our next question, how does the campus plan to enforce the students completing the Daily Health Questionnaire before attending class?
Gloria, I'm going to defer to you, but I'm glad to give an initial response. Our side at medical services is not as focused on compliance. But we are offering tools, as I said earlier, where the student form might be used to confirm that people have completed it. For instance, if a student completes the form and indicates they don't have any symptoms or close contact, they get this lovely little green smiley face graphic that says they're basically good to go. And that could be checked if they are here on campus for entrance to buildings. It could be checked for presence in class. A faculty member might ask, has everybody done their questionnaire for the day? Those workflows have not been fleshed out, but that's one possibility to check for compliance and that people are filling out the forms.
Gloria, was there anything else you wanted to add?
No, there wouldn't be anything I would add to that.
Is there a plan to offer the form in different languages? I think I heard you say earlier that the translation is in progress.
Yeah, Mark's been working really hard on this and the rest of the OIT team. So we'll have 5 translations, I think, that'll be rolled out very soon here.
Yeah, we currently reached out to some individuals for testing for the 5 different languages of the form. So get feedback from that. And once we can confirm that the translations are good and everything looks great, then we can definitely roll that out. And we'll put those links on the same location where the current form is as well.
Our next question, which form should student employees fill out during gaps in their student appointments? For example, graduate students who need to visit the campus, their campus office in the next month or so to pick up a book.
I would say the student employee form. They should still have their identity so they could complete it.
Okay. Current CDC symptoms list fever as well as chills as symptoms. Why does our form not have fever?
Our form does have fever. It's a separate question.
Okay. If I am made aware of an exposure where someone I've come in contact with has tested positive, do I need to quarantine? Do I need to get tested even if I have no symptoms? Do I need to quarantine until the test results are returned?
So if you've had close contact less than 6 feet for 15 minutes with somebody who's tested positive for COVID, yes, you should quarantine for 14 days. As far as testing, if you develop symptoms, you should definitely get tested. We are doing some asymptomatic testing, particularly in our campus community. So that can be worthwhile because of some of the increased cases we've had, especially on the Hill. We do recommend generally waiting about 7 days from that exposure to get tested, because if you test too early, it is possible you'll have a false negative test result. The other thing to be aware of is even if your tests come back negative, you should still quarantine for the full 14 days.
Okay, we are just at 1 o'clock, which is when this webinar is scheduled to end. We have gotten through all of our pre-submitted questions and 28 of our questions submitted during the webinar. We have 26 open ones. So I think what we'll need to do is close out the session, and I'm going to look and see if there's a way to email everyone who registered for this session and be able to provide some follow-up on some of the questions that went unanswered. So it's 1 o'clock now, so I think we should go ahead and wrap up. And thank you everyone for attending and for listening and for sharing your questions, because it does help make this process better as we learn through it.
Thank you.
Thanks.
Thank you to our panelists.
Bye.
Gloria, you and I are still here on the webinar platform, and I am here because I'm going through the process of copying all of the questions that were not answered yet. So I can save all of them, because I don't know if after I close the webinar, if I'll still have access to the questions that were submitted. So I'm just highlighting all of them and seeing if I can copy and paste them. And then I'll close out this webinar, because I have a meeting that I was supposed to be in that started 2 minutes ago.
Okay. How do you think it ends?
Looks like I got him. I got him.
Okay.
All right. Jennifer McDuffie raised her hand. Jennifer McDuffie, still on the session. I think she raised her hand to tell you that you did an excellent job.
Okay. Thanks.
Okay. Thanks, Gloria.
Bye.